Welcome back to Diabetic Food Files. I'm your host, Dr. T. Sorry for the long hiatus. So, today's episode is about something that is so small it's almost invisible in medicine or to medicine. So, we're talking about molecular hydrogen, H2. Not water, not hydrogen peroxide, not oxygen, just plain hydrogen, the two atoms that have one bond. And somehow this tiny molecule is being studied for reducing oxidative stress, modulating inflammation, protecting tissue, and possibly improving wound healing in diabetic foot ulcers. So the real question is this revolutionary or is this just another overhyped wellness trend? So let's break it down. So let's correct something that most people get wrong. Hydrogen wasn't discovered recently, and we all know that, okay? It was known since 1700s. I'm sure it was known way before then. They just might not have documented it. But its medical relevance exploded in 2007 when Japanese researcher I'm Oshawa, uh, pr- please forgive me if I pronounce that wrong, okay? Demonstrated that the hydrogen gas could selectively neutralize hydroxyl radicals. So I'm just going to say how it looks, okay? Because you chemistry people know. Dot zero eight, just say zero. Dot OH. So that's how a hydroxyl radical looks like. And peroxynitrate. Peroxynitrate. Okay, because we talked about free radicals. We did a whole episode of how the free radical work, how it affects the diabetic ulcers. So this was revolutionary, and forgive me for pronouncing it wrong, okay? Because prior antioxidants like vitamin C, vitamin E are non-selective antioxidants. But hydrogen is a targeted redox modulation. So that means that the hydrogen shifted its form from an inert gas to a biological signaling modulator, which is absolutely fascinating. So let's get more into the molecular hydrogen. So what is molecular hydrogen? Like I said, it's H2 gas. It's the smallest molecule in the universe, I believe. Forgive me. Neutral, it has no charge, it's nonpolar, and it's highly diffusible. This matters because it can penetrate cell membranes, mitochondria, and nuclei, unlike antioxidants that struggle to get into cells. So the key concept is most antioxidants react broadly. They can disrupt even beneficial radical oxidative stress signaling, okay? But molecular oxygen is a selective antioxidant. So it targets those hydroxyl radicals, okay? And that's one of the most destructive radicals, okay? And peri I'm going to say peroxynitrite, which is a key player, a major player in inflammation. So without interfering with the nitric oxide signaling, which is a good thing. We want nitric oxide because it helps with perfusion, right? It helps with circulation, right? Vasodilation, right? Cellular communication pathways. So this selectivity in the hydrogen gas is what makes researchers pay attention. So, the hydrogen behavior is governed by physical chemistry, not biology. So, the key properties, like we said, the molecular weight, it's the smallest molecule in existence, 2 grams per mole, nonpolar, and it's neutral. So, why does this matter? Because most drugs struggle with cell membrane barriers, mitochondrial membranes, and blood tissue gradients. But hydrogen can diffuse freely down to the concentration gradients. So, what are the mechanisms of penetration for the hydrogen molecule? Lipid bilayer permeability. So, cell membranes are lipid based, non-polar molecules diffuse easily. Two, it's a non-transporter required. No transporter is required for it to get there. Okay, so unlike glucose or amino acids, hydrogen doesn't need channels to get into the cells, right? And then organelle penetration. The hydrogen gas can reach mitochondria, nucleus, and cytosol. Okay, so the clinical significance of this is diabetic foot ulcers. The oxidative damage is intracellular as well as mitochondrial, but most therapies can only stay extracellular, but hydrogen gas can go where the damage actually is. So let's go back to where it matters the most with our diabetic foot ulcers, the oxidative stress in a diabetic foot ulcer pathology. So the pathophysiology breakdown, we know chronic hyperglycemia leads to advanced glycation end products, mitochondrial dysfunction, and reactive oxygen species overload. And the result is going to be endothelial damage, poor perfusion, neuropathy, impaired immune response, and delayed wound healing. The real villain is the oxidative stress imbalance. There are too many free radicals, not enough antioxidant defense, and this leads to tissue breakdown, chronic inflammation, and biofilm resistance. So, where does hydrogen come in to all of this? Instead of blasting all the reactive oxygen species, we would use hydrogen because it selectively neutralizes the most toxic ones. And that's critical because reactive oxygen species are necessary also for cell signaling, angiogenesis, host defense systems. And then, so hydrogen may reduce damage while preserving the healing pathway. So, what is the mechanism of action of hydrogen? The beautiful one is selective antioxidant activity. So, like we said, hydrogen reacts with the hydroxyl one. So, the OH plus H2 equals what? Water, right? It literally converts a harmful radical into water. Ta-da. This is one of the most misunderstood concepts in medicine. Not all reactive oxygen species are bad. So there are some beneficial reactive oxygen species, like hydrogen peroxide, right? That helps with signaling. Superoxide helps with the immune response. Harmful ones are, like we said, hydroxyl radical. If you add hydrogen to that, turns it into water. Beautiful. And then peroxynitrate, that causes protein damage. So our traditional antioxidants are non-selective and they scavenge everything. This disrupts angiogenesis, immune function, and cell signaling. But the selectivity of a molecular hydrogen neutralizes only the most cytotoxic reactive oxygen species, like the hydroxyl, the peroxynitrate, and I know I'm pronouncing that wrong, so please forgive me, chemistry people, while preserving the physiological reactive oxygen species signaling. And this is why it matters to wounds, because healing requires controlled inflammation. Because I'll never forget this lecture by a gentleman who was talking about fractures, and he's like, the inflammation is good. Like, he don't like the NSAIDs because he said the inflammation is actually part of the healing. Okay, and us bringing the NSAIDs would be delaying the healing process. And I was like, oh, wow, like he's telling the truth, right? So healing requires controlled inflammation because that's how you get the signaling there, right? And then controlled reactive oxygen species. If you have too much reactive oxygen species, there is tissue destruction. If you have too little reactive oxygen species, there is poor healing. So hydrogen helps balance that out, but not eliminate, okay? So hydrogen molecule also has anti-inflammatory effects. So hydrogen down regulates TNF alpha, IL-6, and F kappa beta pathways, and this matters in chronic wounds because what phase is chronic wounds most stuck in? A diabetic foot ulcer, the prolonged inflammatory phase. It's always stuck in the inflammatory stage most of the time, okay? Because we want that fibroblast phase, that the proliferative phase, okay? And we want that nice remodeling phase. That's what we want, okay? So, also, molecular hydrogen plays a role in mitochondrial protection. So, hydrogen helps stabilize mitochondrial membranes, reduce oxidative damage, improves ATP production, because maybe ATP is like currency as well, okay? But the more energy, the better the tissue repairs. Molecular hydrogen also plays a part in gene expression modulation. So hydrogen activates the NRF2 pathway, which boosts antioxidant enzymes, as well as the HO1, the heme oxidase 1. This creates a long-lasting protective effect. Now, another effect of molecular hydrogen that I love is anti-apoptotic effects. So this prevents excessive cell death in fibroblasts and endothelial cells, which are essential for our collagen deposition, like depositing collagen, as well as angiogenesis. So, when we talk about the oxidative stress imbalance in a diabetic foot ulcer, this is how we can connect it all. So, normal healing, you would have controlled inflammation, balanced reactive oxygen species, angiogenesis, and fibroblast activity. In a diabetic wound, you would get persistent inflammation, excessive reactive oxygen species, impaired microphase switching from M1 to M2, right? M2 is failure, and then we have M1 to M2 failure, right? Because that impairs switching, and then poor angiogenesis. And this imbalance will cause increase in reactive oxygen species production, which is not balance to the antioxidant capacity that is in the body. And that would lead to fibroblast dysfunction, collagen breakdown, and endothelial cell death, as well as a biofilm presence. So clinically, we would see a pale wound, slough, delayed granulation, and chronic drainage. And this why what worsens this infection, because especially with the biofilm, ischemia, poor offloading, as well as repetitive trauma. So, what are some products that can help balance oxidative stress? So, I'm going to be practical. Evidence based categories, oxygen therapy. That's why I love me some topical oxygen, and we're going to have somebody soon. So, I'm super excited. But oxygen therapies like hyperbaric oxygen, topical oxygen, improve oxygenization, as well as reduce oxidative imbalance. Advanced dressing. There are some advanced dressing, like hydrogel dressings help maintain moisture. Silver dressings are antimicrobial. Collagen matrices are scaffold repairs. So hydrogels provide this moisture barrier that supports healing. Next are growth factor therapies like PDGF or EGF, very helpful. Negative pressure wound therapy, which we all love, reduces edema, improves perfusion. So where does hydrogen fit into this? This is an adjunct redox regulator. So, what does the research evidence, because we want to be evidence based about this, right? So, in 2023 study, they studied on inflammation and regeneration. Hydrogen increased wound healing rate by 3 times faster. So, it promoted extracellular matrix deposition. I keep on saying deposition. You may think I'm a lawyer. I'm not, but deposition. Okay. Stem cell activation and reepithelialization. 2 is Nature Communications in 2022. They showed that hydrogen generating systems improve diabetic wound healing combined with glucose reduction as well as reactive oxygen species control. Then there is a 2024 review that as hydrogen as a therapeutic agent demonstrated anti-inflammatory properties, protective properties, as well as redox balancing effects. And then in 2023, they showed that atomic hydrogen, had a broad RONS scavenging as well as accelerated diabetic wound healing. And what is the preclinical evidence of that? They had animal studies as well that showed that hydrogen therapy accelerates wound closure, reduces inflammation, and improves angiogenesis. And, the human applications are emerging, but like I said, like I just mentioned, they have shown and studied that it helps with chronic wounds, it helps with ischemia, reperfusion injuries, as well as diabetic complications. So, what are some of the delivery methods of molecular hydrogen? Okay, hydrogen-rich water, actually, or take it orally, a systemic antioxidant effect. Okay, and this is for educational purposes only. Nobody's telling anybody to do all this stuff. I do not like patients who self-medicate. That is not the role you have to do. Let the doctor guide you, said guide you, guide you. You have to let the doctor guide you, okay? So no ever self-medicate, because in the end, I do understand what they're trying to do when you're trying to self-medicate. You're trying to avoid going to doctor because the healthcare system and a lot of people have a lot of mistrust in the healthcare system, unfortunately. I understand that. But in the end, when patients end up self-medicating, they always end up still seeing the doctor because something goes wrong one way or another. So, but I'm always proud of my patients when they decide that, hey, I want to see the doctor. That's what I want. That's what I want. But I understand the concept that it is the wrong route for anybody to go to self medicate without a healthcare professional guiding you. Okay. So That's one side note. Another delivery method, hydrogen gas inhalation. So that causes rapid systemic delivery as well as it diffuses into the tissues. Next is topical hydrogen solution. So like a continuous local delivery or controlled reactive oxygen species modulation, and that like would be topical for like a diabetic ulcer or inhaling inhaling it. So that cause like a systemic as well as microvascular help with that. And then hydrogen infused saline. I have not seen this as yet, but I would love this. IV or topical direct tissue exposure. But for a diabetic ulcer, this is potentially great. Benefits will be reduced oxidative stress, improved microcirculation, and enhanced tissue regeneration. But let's be real, they have not done large scale research, proving it as a standard of care. So it cannot replace, like we said, it's adjunctive. It cannot replace debridement, offloading, or infection control. With hydrogen, water, and hope, a patient can still lose their limb. So you have the whole point is to look at all the things that we have in our toolbox, okay? So let's do hype versus reality. Let's address the elephant in the room, okay? The wellness industry says molecular hydrogen cures, okay? And that's not true, right? The science actually says it has promising antioxidant abilities, it has anti-inflammatory potential, and it is safe in most studied doses, okay? But there is limited large human trials. There is no standardized dosing and not yet any clinical guidelines. Okay. So any overhyping, it could cause a delay in proper wound care for a patient. It could cause a skip in antibiotics. And, no matter what, you have to see vascular, no matter what. Okay. And our responsibility as clinicians is to be curious as well as knowledgeable, but not to be reckless. Okay. So, what is the future of hydrogen in podiatry and wound care? Where can it go? Potential integrations will be hydrogen infused wound dressings, adjunct therapy for ischemic wounds, post debridement, oxidative control, and combination with growth factors. And, research directions. Hopefully, they'll do more diabetic ulcer research studies, optimal dosing, delivery systems, which is best, and combination therapies. Okay. So, key points is molecular hydrogen is not magic. It is a selective antioxidant. It may help regulate oxidative stress and inflammation, and it shows promise in wound healing. And like I said, it's adjunctive therapy, not a replacement. So you cannot ignore the key principles of debridement, infection control, offloading, and vascular, no matter what. Here's the key. If you have diabetes, see the vascular doctor, no matter what. And you should see them once a year. See them once a year before anything, okay? See the vascular doctor once a year. Have a full workup. I promise you, you won't regret it, okay? So, also, there is no widely adopted FDA approved hydrogen wound products as yet, okay? But like we said, it's still emerging. So, also, when it comes to insurance right now, your insurance covers debridement, hyperbaric oxygen therapy, and negative pressure wound therapy, right? But for hydrogen to be covered, it needs to have large randomized clinical trials, standardized protocols, and cost-effective data. So, likely pathway for hydrogen right now would probably be adjunct therapy, a niche used possibly in ischemic wounds, and integration into guidelines. Okay. So, what is our final takeaway? Again, molecular hydrogen is a selective antioxidant. It is a redox modulator, and it has potential in wound healing as adjunctive therapy. It is not a replacement therapy for standard care. It is not a miracle cure. Okay. But the real pillars remain, which is offloading, debridement, vascular optimization, and infection control. So hydrogen doesn't replace the fundamentals, but it can enhance them. That's what we want. Any way that we can enhance the wound healing and make the patient's quality care of life better, that's best. Okay? Sometimes the most powerful interventions are not the biggest ones. Sometimes it's the smallest ones, like the hydrogen, and it might just be one of them. And this is Diabetic Foot Files, where we break down the science so that you can save limbs, change lives, and see wounds differently. I'm your host, Dr. G, and take care of your feet because it takes care of you.